again, Dr. Lennox Hoyt, fellowship-trained urogynecologist and pelvic surgeon. And the truth is, leaking stool is not fun. There's no celebrities, there's no spokespersons, there's no models that get up on the silver screen or the television screen or the internet and talk about their journey from leaking stool to not leaking stool. So it's something that's considered to be taboo. Not very many people talk about it. And yet, many women experience this problem. It can be pretty distressing. We get sometimes women that are young, otherwise healthy and vibrant, active physically, sexually, and so forth, that are leaking stool, and quite frankly, it's embarrassing. It turns out that there are practitioners, doctors, surgeons that treat stool leakage. The most important thing is to find the right kind of practitioner, right kind of doctor. Those doctors tend to be fellowship-trained urogynecologists, sometimes and often colorectal surgeons, fellowship-trained, and sometimes special gastrointestinal specialists are the primary doctors that you would be wanting to talk to who may be able to help you with stool leakage. It's going to be important that as you go through this pretty distressing set of symptoms, you want to go to someone who can accommodate you and sit and listen carefully to your complaints. As you go through your journey, it's going to be a pretty tedious, thorough, sometimes painful journey. You want someone who can hear you, who can listen to you, who can accommodate you, who will not shame you, and who will offer you options for diagnosis, for testing, offer you a full discussion of your treatment options, which can include physical therapy. It can include sacral neuromodulation, which is a special type of pacemaker for the bowels that can help in certain cases, dietary advice and modification with nutritional therapies, and sometimes surgery can be helpful depending on what the diagnosis and the cause of the stool incontinence is or the poop leakage is. It's going to be really important to have in your corner someone who will advocate for you, to help you get to the end of the journey such that you can get your life back. Oftentimes having a partner, a social partner, a husband, a spouse, family member who is vested in your successful well-being and your journey, who will travel it with you. Definitely having a provider and an infrastructure, and a provider as in a medical provider, a doctor, a surgeon, so forth, with an infrastructure that's built around supporting you emotionally, spiritually, that can listen to you and hear you and learn enough about your journey and your symptom set, but who can also evaluate you in great detail to try and locate the source, anatomic, physiological, dietary, the source of the problem, such that you can be offered appropriate treatment. Many women with stool incontinence can be cured, especially if it's the isolated stool incontinence in the setting of someone who's otherwise healthy. So it's going to be important to find the right kind of provider. Please do understand that there are 4 things that you're looking for in a provider. 1 is compassion. The second is somebody who's well-trained and understands the diagnostic methods and management options for treating this problem. Somebody who will support you emotionally and spiritually in your practice. Somewhere in the practice, there's an individual who will support you in your journey and who will listen carefully to you as you go through the process of learning about the diagnosis. And also someone who will advocate for you, usually a family member or somebody really close to you, a dear friend or whatever, that will support you. This is a complex situation. It requires a lot of care and a lot of attention in the diagnostic treatment option and management process. So please be prepared to spend a lot of your time, effort, and sometimes your resources in order to commit these things towards finding a solution to the problem.
In terms of types of bowel incontinence, as far as the woman is concerned, if she's leaking stool, that's a bad situation. And so for the patient, the woman herself, there's really only one type of bowel incontinence. However, when you think about the ways that stool can leak, for example, leakage of liquid stool usually is associated with a dietary situation. Leakage of solid stool usually is associated with a mechanical situation that can sometimes be remedied by either with physical therapy, stool bulking, or sometimes with surgery.